This video here, I'm doing a little quick crash course to some of my instructors. And so I'll talk you through what I'm doing, okay? And so first, what I'm doing here is I'm pointing out that you're palpating the spine of the scapula. And by doing that, you can establish the directionality of the supraspinatus muscle. I'm about to demonstrate how to properly obtain local twitch response, or what some people call fasciculation. And that's to get the muscle to jump or quote unquote release. And I'm demonstrating the different angles with my hand to show you that I'm actually walking down the valley of the supraspinous fossa. So I'm inserting towards the top of the fossa, which is you're about to see. I insert strike bone, so it actually is periosteum pecking. There's a lot of nerves in the periosteum, and now re-angle anteriorly, and I'm doing a little pistoning action. So I'm actually walking down the fossa, and each time striking the periosteum, so stimulating the nerves in the periosteum. And by doing this systematic coverage of the fibers and basically kneeling perpendicular to the fiber direction, which runs this way, we increase our chance to obtain a local twitch response. For a long time, I have been unhappy with my ability to obtain local twitch response with this muscle. Everybody can get local twitch response of the trapezius very easily. Sometimes you're not even trying to do it and you get it. But the supraspinatus, to get it reproducibly and reliably, has always been challenging for me until I discovered this kind of what I call walking down the valley technique. Now I'm demonstrating kneeling into Li16, which is that AC joint. That's the sensory articular nerve I mentioned. And the needle I'm using right now is actually a 50 millimeter needle. I'm simply demonstrating that with proper needling and proper understanding anatomy, we can bury the entire 50 millimeter needle, and there still won't be enough needle left to go down. So we use this technique to stimulate sensory articular nerves. And what I will actually do is I will connect electricity to the supraspinatus muscle and to the sensory articular nerve. I will connect electricity with one line this way. Now, next I'm about to demonstrate how to locate the tendo-periosteal junction. Over here on this side is where the muscle becomes a tendon. Over here on this side is where the tendon attaches to the periosteum on the humeral head. And earlier we've marked the tendon on this volunteer when she was standing, but the position changed a little bit. So don't let the line location confuse you as to where I'm inserting. This is a technique done by palpation, and you estimate the directionality of the supraspinatus based on the spinous process. It's just the spine of the scapula, and you follow the curvature down. And fortunately, if the patient actually has pathology of the supraspinatus tendon, it'll be very painful by palpation. So even if you're not very good at palpating tendon, the patient will already tell you where to go. So you're going to insert a needle on either side of the supraspinatus tendon. So this is actually what is called a subacromial needling technique. We are needling under the acromion. Fantastic technique for subacromial bursas, etc. Okay, or obviously supraspinatus tendinopathy, tendinosis. So this technique, I'm also now demonstrating that by anchoring my middle finger. Watch my left hand. I'm pointing it towards large intestine 16. I'm showing you that by using my middle finger as distraction, patients feel a blunt pressure from my finger more than the sharp punctate needle itself. This is how you can get a needle that's thick and deep into a bony space while making it tolerable and comfortable for the patient. You simply push more with your finger than you do with the needle itself. So it's a kind of a technique to be able to independently move your fingers, push with the middle finger, and then sliding to follow with the thumb and index finger. So these are techniques I will use and are things I look forward to sharing with you.